Okay, so we're gonna focus like on the pediatric dose calculations because those are the ones that obviously require kind of the most math associated with them. So let's go to LexiComp. Let's say anyway, so I'm gonna say what drug do we want to give? Let's do cephalexin or Keflex. Okay, so say we have a kid who's got a skin infection, got a little bit of cellulitis. Let's do some Keflex, right? So I like LexiComp. That's just what I use most frequently. And again, when we do this, we would want to go ahead and use the pediatric variety, right? So again, I like to use the pediatric database because that's going to be much more specific to the information that I'm actually looking for. Okay. So anyway, I'm going to do a new document here, and I'm going to actually do the math with us. So okay. All right, so we're going to go through, we see our Keflex, we're going to look at our pediatric dosing. Let's see, do we have anything for skin soft structure infections? Good. So notice I'm looking up based on the indication here, right? So I said I got a kid with some cellulitis. Let's go ahead and treat him with that Keflex based on that dosing. Because you can find based on the indication, the dosing may change pretty greatly, right? So again, if I'm treating meningitis versus pneumonia versus a UTI, the dosing can be quite different. So you want to make sure you're looking at it based on specific indication here, okay? So I'm going to see here if I'm going through and looking, okay, so for infants, children, adolescents, let's say we're dealing with a child, let's say we're dealing with like a 4-year-old, oral 25 to 50 milligrams per kilogram today divided every 12 hours. Max dose 500 milligrams per dose, okay? So that's what we're going to use for our dosing here, okay? So I will say we're going to have, let's do 50 milligrams per kilogram per day divided Q12 hours, right? And then we'll do a duration, 10 days. And let's say our kid weighs, I don't know, what do you guys think of? 30 kilograms. It's a big 4-year-old. Big 4-year-old. Let's do something that's like going to be more difficult than what would be on the test, like less round numbers. Let's do 17 kilos. Okay. So we got a 17 kilogram child that we're going to be dosing this for, okay? What other piece of information do I need? The strength of the thing, right? Because again, if I have a 4-year-old, they're going to take tablets. Highly unlikely, right? So let's go ahead and look. And again, here with LexiComp, I know I can go down to dosage forms. That's going to tell me how this comes in. So I can see it comes as an oral capsule. That's not what I want. I want the suspension reconstituted. And I see here it comes as 125 per 5 ml. Now, what do you think this is here in parentheses? Those are the bottle size. You don't really care about the bottle size. You're just going, when you write your prescription, you're just going to write how much you want the patient to get. We'll figure it out from our end how many bottles they need to give, more than one or whatever it happens to be. Okay, we will pour from the big bottle to the little bottle. So I go to school for 4 years, and you count to 30 by 5s. But we'll figure that out. Okay, so you don't have to be concerned with that so much. Okay, so again, the final piece of information I need here is going to be 125 milligrams per 5 mLs. Okay. Now, just based off of this, one thing I can just do to help make my math a little bit easier, I can just say, okay, well, I know that's a 25 milligram per ml concentration. Okay, let's just take out the per 5 mLs and not have to worry about that. Okay, got it. So, next question is, all right, well, what's my actual dose going to be for this patient? How many mLs do they need to get per dose? Because that's what's going to be on my script, right? So, what's the first step? Take 50, so I'm going to do 50 milligrams per kilogram per day. I'm going to multiply that by 17 kilograms, okay? Which should equal out, so 50 times 17 is going to be 850. So we're getting 850 milligrams, right, per day, right? Because the kilograms have canceled out at this point, right? So they're going to get 850 milligrams per day. Now I want to divide that by 2, so I'm going to take 850 milligrams per day. I'm going to divide that by 2 doses per day, right? Basically. That's going to equal out to be 425, right? 425 milligrams per dose, right? They're getting doses per dia, right? A little bit of Spanish. See?
Very nice.
Ah, see?
Very nice.
Sí, muy bueno. Anywho, all right, so we got this 425 milligrams per dose. Now, what do we need to do?
Divide that by 25.
Yeah, so we need to actually take the concentration, factor that in to figure out how many mLs they're going to get. So I'm going to take 425 milligrams per dose. I'm going to divide that by 25 milligrams per ml. So the milligrams will cancel out at this point. And then what do I got left? mLs per dose, right? So I'm going to take 425 divided by 25, 17 mLs. 17 mLs per dose. So if I were to write that on a script, that sounds like a lot, and it kind of is, but it is what it is, right? So then you liquid, That's what it is. So we're going to say, okay, so we got 17 mLs per dose. So on my prescription, what am I going to write? I'm going to say, all right, cephalexin. And I can write Keflex. And anytime on a test, if I write a drug name, I will put the brand name in parentheses. It's always safer to know a drug by its generic than by the brand name, but people just know Lasix. They don't call it furosemide. Z-Pak, not azithromycin. It just depends, but a lot of people know it by the brand name. So, but you can't go wrong knowing the generic. So on my script, I'm going to write the name of the drug. What else do I need to include on this line? The strength of it, right? So I'm going to say 125 milligram per 5 ml suspension. Okay. Now, what do I put? Take 17 mLs by mouth, so PO, so I can write PO, so per mouth. So I could write BID. What else could I write? I could write Q12 hours. I could write twice daily. Any of those are fine. So, that's correct. Would a patient necessarily understand POBID? Probably not. However, what we will do on our end of things, because again, this is more like a practitioner sort of communication, we will then, and again, most of our computer systems are designed to go ahead and take, when you write in PO, it'll just pop it out as by mouth, right? If you write in BID, it'll pop it out as twice daily, right? So you don't have to worry about that, right? So again, it's okay to use some of these abbreviations. If you wanted to write out everything textually, that's totally fine. I'm not going to fault you for that, right? For having too much on there. And again, I'm recording all of this, so I'm going to post it up so you don't have to worry about it. Yeah. Anyway, so I can write any of those. So so I have my frequency now. Okay, so I can do that for 10 days. 10 days, because you want to include how often. So you can do times 10 days, or you can say for 10 days. Yeah, so I can write for cellulitis. Right? So that way, when the pharmacist gets that, they can look at it and be, okay, I know it's for cellulitis. Let me double check the dose, right? Because again, that's why we want to make sure that if there's any holes in the Swiss cheese, we can block it up by the next provider, right? So again, if you just write, 17 mLs twice a day for 10 days, I have no idea if that's for otitis media. I have no idea if that's for a UTI. I have no idea, right? So again, that's by including the indication is very useful with that, okay? And then I'm going to write for my quantity, how much? So how do I need to figure out my total quantity to dispense? 17 times 2, because you're getting 2 doses a day, right? Times 10. So you can say, okay, I'm going to dispense 340 mLs. Right? And then how about refills? Why 0? Yeah, hopefully the infection is gone. You never want to put refills on antibiotics. There are some rare instances where you may want to. So, for instance, if you have a patient, it's beyond our scope right now, but for instance, if you had a patient who they know they get, they have like chronic illness, so they get like kind of recurrent UTIs, and then this thing works for them, occasionally you may do that. It's very rare that you do that. Or if you have someone like, say, like a heart valve replacement, and maybe they're going in for like a dental procedure or something, they need like a dose of antibiotics for prophylaxis, sometimes you'll do that. Rare instances. For our purposes, antibiotics, you don't do any refills for them, okay? And that basically be your script. And assign at the bottom, have all the information at the top, and then you're good to go for the most part.
This may be a dumb question, but for refills, do you seriously do like the 0 with like the dash?
That's fine.
Okay.
Yeah, because I was mentioning this during the break, but yeah, if someone came in through and they said, oh, I really want some extra Keflex just in case. Right, one before that, yeah, potentially they could do that. That would be very odd. Like the pharmacist would be like, "There's no way you wanted 10 refills on this, right?" And then you'd be like, you'd probably yell at the patient for trying to alter the scripts. But yeah, do slash through the 0 is totally fine. Yep. Okay. Do you want to do another one? I'm at time, but I can do another one if you like. Yeah. Okay, let's do another one. Again, I'm just trying to show you different, ones you may do. Just based on routine clinical practice, not the ones on the prescription assignment necessarily. What's another good one? Let's say I want to dose, let's do ciprofloxacin. This is a fluoroquinolone antibiotic. Let's say we're going to do, and again, notice here there's different varieties, right? So the lexicomp, you have to make sure you pick the right one. So if I pick the ophthalmic one, I'm probably going to get a bunch of eye drops. It's not going to make sense based on what I'm going to dose it for, right? Versus I'll get the otic, it's going to go where? In the ear, good. So I want systemic. That's going to be either oral or IV, those kind of formulations there, okay? So I'm going to do ciprofloxacin. Let's say we're going to do treatment for, let's treat someone for the plague. That sounds like fun. All right, so we got our plague treatment here. I've never treated the plague, but you never know when the plague might attack. Okay, so for plague, anyone know? Well, I hope I can spell it right. A-G-U-E. That's very plagoo. Anyone know the bacteria that caused the plague? Yersinia pestis. That's one. Anyway, so 15 milligrams per kilogram per dose. Right, and it's going to do every 8 to 12 hours. Let's do Q 8 hours, just so that way we at least have something different than what we did last time. It says for 10 to 21 days. Let's just do 10 days, right? It's a minor case of plague, we'll say. Okay, so let's say we're working off, say, a 12 kilogram patient. Okay, and then what else do I need to know? How the drug comes, right? So we wanted the dosage form itself. Okay, so we're going to go down to dosage forms, and we're going to say, so notice we have multiple solutions here. We have there's only one solution to this problem, but there's multiple solutions that are available. Some are IV, some are going to be oral, right? So you have solution intravenous, I don't want that. Solution intravenous, I don't want that. Suspension reconstituted, that's the one I want, okay? So I see here it's going to be Cipro. They'll have the brand name it's available. They'll have the generic. Okay, this one is a 250 milligram per 5 ml. Let's go ahead and go with that. So Cipro suspension comes as 250 milligram per 5 ml. Okay? So what's my first step? What am I going to do? All right, so I'm going to do 15 milligrams per kilogram per dose times 12 kilograms equals, so 15 times 12 equals 180. That equals 180 milligrams per dose. Okay, now what do? Do I divide by 3?
No, per dose.
Per dose. So it's already taken care of. I don't have to divide. Be very careful with that. That can lead you to wrong answers on the test. And I take that into account, and I'll put some answers on there that look exactly right. But if you didn't divide, or if you did divide when you shouldn't have, or vice versa, you're going to be wrong. Okay? Be careful with that. Look specifically for what I'm asking for. Keep the units straight. So this is 180 milligrams per dose. I don't have to do anything more to that dose. That's the total dose we're getting with each administration. Okay. So now what do? All right, because again, at the Cipro suspension, I can go ahead and say 250 divided by 5 is going to be 50 milligrams per ml. Okay, so I can take that 180 milligrams per dose, then divide that by 50 milligrams per ml. That equals, it's 180 divided by 50, 3.6 mLs. So this patient will be getting 3.6 mLs per dose. Okay. So let's go and write the script. Let's figure out how we're actually going to administer that. So we're going to say ciprofloxacin. We say Cipro is a brand name. Oral suspension. So I already know it's an oral medication. It's going to be 250 milligrams per 5 mLs. Okay. Now what are my instructions? Take 3.6 mLs PO, or orally. You say orally. So I could write TID. I could write 3 times daily. I could write Q 8 hours. Any of those would be fine, right? So getting 3 doses per day, okay? So for 10 days, for plague, GUE, good. And as a pharmacist, I'd be like, oh, you should go away from my pharmacy instead. I don't want you spreading stuff around here. Okay, so then for quantity, be what? So I take my dose 3.6 times 3 administrations per day times 10, so 108 mLs. So I could say, if I wrote 110, it's not going to be wrong, but just for specificity's sake, we'll say let's do 108 mLs. Okay, and then my refills should be 0. You can do that same math for any type of problem like that. You just have to keep your units straight. Notice if it says per day, per dose, if it says divided by, if it just says Q8, Q12, whatever happens to be, just be very specific. I'm not going to be tricky, but this stuff is inherently tricky if you're not looking at it carefully. Okay? Everyone with me so far? Okay. You want to do like a fluid one real quick? Just for... Yep, that's the specific one I'm going to do here. So let's say... let's do a 54... I should probably do bigger font. I had this one physics professor, and he was writing everything on the board, but it was like one of those big lecture halls. And he was like, please let me know if I need to increase my font. With his like chalk. I always thought it was a very funny concept. But anyway, let's say we have, let's do a 54 kilogram, 543 kilogram, but 54 kilogram patient. 543 kilogram. I've 960 pounds is the highest I've ever seen a patient go. 960 pounds. Not kilograms, that would be. That's still, yeah, it was a big patient. He came in for difficulty breathing. I was like, yeah, I'd say difficulty everything. Like, it was insane. Anywho, though, so we have a 54 kilogram patient. So let's go ahead and do a fluid bolus for that patient. So how do I figure that out? So 20 mLs per kilo per dose, right, for the fluid bolus. So, right. So for that, just do 20 times 54, right, kilograms. Should equal out. So do 20 times 54, 1,080 mLs per dose. Now, realistically, what would I just round that to? Just give him a liter. Just give him a liter of fluid and set it and forget it, right? So once I've done, then I don't have to think about it. But just for completeness sake, for specificity, we'll say 1080. Yes, sir.
So when you're doing this, is this always assuming it's 0.9 of saline, or can we do lactated ringer?
You could do either, and I'm probably not going to specify. I'm not going to like put one answer as like 1080 mLs of NS and a liter of lactated ringers and expect you to delineate between that. It goes into like where you're working at, what setting you're in. Like for instance, surgery does lactated ringers 9 times out of 10. ER we do normal. Everywhere else we do normal saline 9 times out of 10. So those are the two main ones you're going to see being used for boluses of fluids from this standpoint. Yep. So because you want isotonic fluids, we'll go into that at a later date, but you want isotonic fluids, and both of those are considered isotonic to our blood, essentially, right? So now if I want to do maintenance rate, I want to figure that out with the 4-2-1 rule, right? So that means for the patient's first 10 kilograms, it's going to be 4 mLs per kilogram per hour, which for this patient, I'm going to multiply that by 10, because that's that first 10 kilograms, right? So I get what? 40 mLs per hour, right? Because this is our maintenance rate. This is going to run continuously for this patient, right? This is meant to replace the ongoing losses that occur just by living, right? By urinating, by breathing, by sweating, all that kind of good stuff, right? This is maintaining normal fluid balance. Okay, so that's the first 10 kilograms. For the second 10 kilograms, it's going to be what? 2 mLs per kilo per hour times, this guy weighs 54 kilos, so we still have a full 10 we can work with off of here, right? So that equals 20 mLs per hour, okay? Now, for every other kilogram, it equals 1 ml per kilo per hour. Now at this point, what do we multiply by? 34, because this is what we have left over. So 34 kilograms is going to equal 34 mLs per hour. So now our total is going to equal 40 plus 20 plus 34, which equals 60, 34, 94 mLs an hour, right? 94 mLs per hour. And that would be a maintenance rate for that patient. So I'd give them a liter of fluids as a bolus, get them tanked up, and then give them the maintenance rate, 94 mLs an hour. Okay? Now, if the patient only weighed, say, 17 kilograms, you just stop at the 2-step. You don't have to go to the 3rd step there, right? Because, again, they don't have more than 20 kilograms to work with there, right? Okay. Again, if I ask about a patient who's weighed in grams, make sure you convert it to kilograms, right? Just divide by 1,000. I probably won't get that tricky on the test. I don't remember if I did or not. I don't think I did. But, again, make sure everything's in kilograms. Yes, ma'am.
So
Absolutely, yeah. So for the 17 kilo patient, I get 40 mLs an hour for the first 10 kilograms, and I had to do 7 times 2, so 14. So 14 plus 40, 54 mLs an hour, right? Is there any other questions I can answer for you? Again, know your definitions, know the big concepts. Again, this is cumulative, so everything's fair game here, right? Be able to do the math. The math is the easy part. If you can get this down easy, those are easy questions to get right. You know, those are easy points you can get. It's not like you have to memorize anything. You just have to be able to execute on the steps there, right?
So would you say for the final that we should maybe like focus on the objectives that you have at the beginning of each?
Those are things we covered, but I couldn't say specifically that I gave more precedence to one objective over another. I would say, like, if I talked about it a lot in class, if I tend to harp on things, you know, if I tend to say, like, wink, wink, might be a question, like, those are obviously things that I would definitely want to focus on. But again, you don't have to go outside of the slides. Everything's right there. One thing I wanted to mention to you guys now that I think lit a light bulb off in some people is when you're taking tests, you know, the way I took tests when I was in school, when I was in pharmacy schools, they had these awful test questions where basically they would give you 4 statements, and then you have, it's called a K-type question, where it said, okay, 1 and 2 are true, 1 and 3 are true, 1, 2, and 3 are true, none of them are true. And you had to select one of those. Those are awful, right? The only way I could get through those was if I treated every single answer choice as a true-false statement. So instead of taking a 50-question test, I was taking a 200-question true-false test, okay? So everything had a 50-50 shot of being right or wrong. So I go through and I say, okay, well, this one's obviously wrong. Take it out. I don't have to think about that one anymore. Get it narrowed down to at least those two options, hopefully. And then you can say, okay, well, this one I believe is true because of this. And again, go with your gut. You've seen this stuff multiple times. Just go with your gut in these cases, okay? That'll help some people. Some people won't. It just depends on how you think about it. But again, I like to be able to eliminate things so that way I can just kind of take them out of my mind and just focus on what is left over. So that way I can say, okay, this is the right one or this is not the right one. Make a decision, okay? What else? You can go back through, review the videos. Again, this test is not bad from a, this is more memorization of things like concepts and definitions. This is my least favorite test that I write every single year because I don't really care so much that you memorize the specific definitions of things. I care about how you apply what we know, and this is what Pharm 1 and Pharm 2 are all going to be about. I love those tests a lot more because I can say, hey, here's your patient. Here's all the facts about this person. How do you decide what the best drug is? Here you have 4 drug choices. Pick the right one, you know. Some people find that harder, but it's what you're going to do the rest of your careers, right? So you got to be able to do it. Okay, anything else I can answer for you? If you have questions, email me. You have till Wednesday. Make sure you get the homework assignment turned in. I'll grade those, and then you should be good to go. Yes, ma'am. For that test, inquire with Dr. Murray. I'm not sure. I believe whatever the typical 50-question test is going to be is what you'll get, but confirm with them. Huh? Maybe 15, maybe an hour. I'm not sure. Yeah, you guys can take a calculator with you. Non-programmable calculator.